Good afternoon, everyone. I'm Krystal, and I'm chair of the Communications Committee. I'm here today with Dr. James Cotton, and he's from the Shirley Ryan AbilityLab. He's a physiatrist and a scientist, and thank you for joining us today.
Thank you for having me.
We really enjoyed your keynote lecture, James. Can you tell us the main points of your talk for our listeners?
Yeah, so in the first part, I tried to kind of broadly lay out some of the context of AI and the ways I think it will particularly need to be thought about differently for rehabilitation. And the second part, I talked about some of the work we're doing at Shirley Ryan AbilityLab, where we're really trying to push computer vision for movement analysis into clinical practice. And because so much of what we do in rehabilitation is try and treat and improve movement and function, try and get to where we can quantitatively measure that in practice.
Sure. What excites you most about the use of artificial intelligence in rehab medicine?
I think for me, it's that there's so many questions we just haven't been able to answer that I think we can start asking differently and make real progress on. I think rehabilitation has struggled to make progress through a series of randomized controlled trials. Not to say that those haven't led to progress, but the progress hasn't been anywhere near as quickly as we would like. And so I think the ability to truly measure much more richly about how people are functioning across levels of the international classification of functioning and take that into big data is going to give us whole new approaches to put forth new hypotheses of how to optimize treatments for people and improve their long-term ability.
Which areas do you see the biggest impacts so far?
So far in clinical practice, I think from talking to my colleagues, probably the most common would be the use of, say, digital scribes in their clinical practice, which can really reduce some of the documentation burden and workflow. But as I kind of alluded to, where I'm really pushing and the most bullish is just measuring these things that we've never been able to measure that are so critical to our patients' outcomes.
Do you mind walking us through some of the challenges of what AI presents us that we sometimes are a bit hesitant with?
Yeah, I think there's a lot of challenges. So I guess it's just like how long do you have? But I think there's a lot of technical and engineering challenges to truly implement these things. So for example, we've been working with this technology for years. We have a huge amount of infrastructure that makes it somewhat lower effort to collect this data at scale. And while we try and open source what we can, still it requires a lot of engineering expertise to get these things going. So I think for real world usage, we're going to need a lot of something that looks almost like product development to make these tools easy to use. Another problem is that while we can measure a lot of things, it's not the same as showing that you can have a detailed measurement of joint angles over time to produce clinical insights. So we're going to need this next layer of analytics that are really designed and validated to integrate into care. And then I think there's also a lot of blind spots in AI as it relates to people with disabilities. So making sure the data sets that are out there and that are being used to train in large-scale models and the way they're being validated is very thoughtful to the clinical populations that we work with.
Yeah, totally agree with you on those points. If you really were to fast forward, say, the next 5 to 10 years, what do you think AI would look like for rehab medicine?
I think the practice, I would almost frame the question slightly the opposite way around. I think the practice of rehabilitation medicine will look a lot different because of AI, but we won't think about it so much. It'll just be in the background. So, for example, right now in therapy, a lot of time is spent on measuring outcomes, and we have all this whole, menagerie of different outcome measures that we use to try and understand functioning. And then we don't even really have insights into what's happening in the real world, right? So we talk about the doctor's walk when people walk differently in clinical practice, in clinical encounters. I think we'll start having a lot more ambient technology out in the real world, and we'll really know how people are functioning, and we'll use that to guide how we treat them, and we'll spend a lot less time doing formalized outcome measures in practice and a lot more time just trying to make that better.
Yeah, that's fantastic. Thank you for your insight and perspective today. We really enjoyed that keynote lecture.
Oh, thank you so much for having me. I'm really enjoying the meeting so far.
Thank you.